Hello friend, is your child complaining of knee pain or is pain around the leg which is also present in the outer side of the thigh? Have you ever wondered why this pain is coming? Do you feel that this pain only comes when your child goes for play and comes back after the long run? Then your child can be suffering from something called as Iliotibial Band Friction Syndrome. Confused? What is this? Let me explain. Iliotibial band friction syndrome is a repetitive strain injury that is very common in runners. Iliotibial band is a structure which is tight in nature and gives certain level of shape and sturdiness to your thigh and the leg region. This is a structure that is present on your outer thigh region and has attachment to the knee. Many a times when an individual is involved in running for a long period of time, there is a lot of strain that falls on this particular structure, which causes irritation and then inflammation. This inflammation can give a sensation of severe pain sometimes, which could be unbearable or excruciating and can make you go to a doctor immediately. But worry not, this is just a pain that has come out of a repetitive strain injury and can be easily managed. But before that, let's also understand some of the symptoms. Whenever there is an iliotibial band friction syndrome, definitely there will be pain, but along with pain, the child may experience heaviness around the leg region, thigh region. The child can feel burning sensation around that area, and if the pain further aggravates, the child can limp or else guard the leg in a way where doing a free movements of the leg becomes difficult. This limping and tightness, if continues for a very long period of time, can give you a lot of other complication and pain in future. That's why correcting this RSI, repetitive strain injury, is very important. So let's understand what you can do in order to deal with this kind of problem. So point number one to keep in mind is, if your child is experiencing any kind of knee pain or leg pain which is more than 3 days, please see a doctor and get the right diagnosis first. Don't make a diagnosis by yourself. The purpose of making this video is also to educate you, but not to make you do your diagnosis by yourself. The second thing that you need to also do is take care of the warm-ups first. Many a times children who are especially involved in sports don't do adequate amount of warm-ups. This puts their muscles in more strained position and can give pain. That's why it's important that whenever the child is involved in any of the athletic activity or play-based activity, the child should definitely go for a warm-up routine. A coach who works with the child very closely would be able to suggest the right kind of warm-up for him or her. That was tip number 2. Let's move on to tip number 3, and that is icing. Once your child goes for play, comes back, and if he or she is complaining of mild ache or any sort of pain, make sure to apply ice pack over that area. Ice pack will reduce the inflammation immediately and will bring the pain under control. So make sure to apply ice pack whenever your child is complaining of any sort of acute pain. The fourth thing that you should do at this time is also to avoid strenuous activity if the pain is more. Children are involved in play and they are so much attached to it that sometimes they will push themselves even though the injury is present. Make sure that if there is an injury, it requires rest for few days. That doesn't mean that child don't have to walk at all. All I'm trying to say is the child has to avoid extreme running activity for few days till the symptoms come under control. Meanwhile, he has to stay active by walking around, roaming around and doing mild and gentle activities. The next thing that he can do is taking physiotherapy treatment. Physiotherapy is a safe way to cure or else work on the injuries. Physiotherapist uses machines like ultrasound, IFT, TENS, EMS, etc. to work on reducing the inflammation and pain by relaxing the muscles. So make sure to pay a visit to a physiotherapist who would be able to help you out in identifying the root cause of the problem, at the same time correcting them. That's not all. At home, make sure that there is an adequate support given to the knee with the help of a kneecap or else a brace. This will prevent further strain falling on the iliotibial band and will help to reduce pain. After a few days, once the pain comes under control, the next thing that needs to be done is exercises. But these exercises have to be very gradual and progressive in nature. Here, you can start with some gentle activities or gentle movements like slight knee bending without pain, knee movements without pain, and simple cycling activity without pain. Your child can progress to further actions as well, but ideally, this should be done under supervision of a physiotherapist. So, my intention of making this video is to let you understand the importance and the criticality of taking the right rehabilitation measure. Make sure once your child's pain is under control, he should involve in a rehabilitative exercises that will allow him to go back to the sport. Once the range of motion exercises are done, he might need to go through some stretching exercises. At the same time, he needs to strengthen the leg muscles in order to maintain or bear the forces that falls on the leg while he or she is playing or running. Remember, any injury takes its own time to heal and recover. So does this. You need to be patient and you need to do all the important steps that I have mentioned in this video. If you still feel that you have some more doubts related to this particular problem, or else if your child is suffering from any kind of knee pain or knee related issues, feel free to write them down in the comment section below. We would love to hear your feedbacks and your concerns and would be able to help you out. On that note, I'll end this video here and I'll see you in another video. Thank you.